Welcome, everyone. Thank you for joining us. Today's program is best experienced on a laptop or tablet. If you are joining us by phone, visual presentations may not be easily viewed. Please enjoy the program.
Good afternoon. I'm Christina Friesecker, and I'm the President and CEO of Shutdown. I also have the honor of serving as Chair of the Board for the Econ Club of Grand Rapids. It is my pleasure to welcome you to today's special event held in partnership with the West Michigan Health. We hope to have a rich conversation about the most pressing issues our community faces, protecting lives and livelihood in the face of COVID-19. On behalf of the Econ Club, I want to thank you for making our discussion a priority. I'd also like to recognize our seasoned partners without whom this programming would not be possible. Aon, Consumers Energy, ITC Holdings, Miller Johnson, and PNC Bank. And now, please help me welcome John Kennedy, President and CEO of Unintended Medical and Chair of the West Michigan Policy Forum.
Livelihoods is paramount for our business and community. In partnership with the Econ Club, the West Michigan Policy Forum is excited to hear from businesses and healthcare leaders today on how we move forward together, smarter, safer, and stronger. Before we begin today's program, I would like to recognize and reflect on the legacy of a founding member and the first West Michigan Policy Forum co-chair, Peter Secchia. Peter was a giant in this community, and much of our success are credited to him. He put 100% towards every endeavor. The West Michigan Policy Forum was no different. Over a decade ago, Peter's vision, energy, and bold ideas and understanding of policy helped define our mission and purpose. Peter inspired and engaged the business community to pay attention to the importance of good public policy and his ability to discern, focus, and prioritize the big issues made his impact on this organization immeasurable. It was personal for Peter, and he had a passion for policy to combine with bold activism and deep generosity. He was focused on moving Michigan forward. We are grateful for his legacy and remain inspired to carry on his vision. We are eternally thankful for his dedication to the West Michigan Policy Forum, the Econ Club, and so many other organizations and philanthropic efforts in our community. He will be dearly missed, and our thoughts, our prayers are with Joan and the entire Secchia family. I think Peter would have been very interested in today's discussion. We look forward to a dynamic dialogue with leaders from diverse industries about the response to the pandemic to get a better idea of where we stand and, most importantly, what we should do going forward to keep Michigan safe and open. I would like to thank our sponsors, the West Michigan Policy Forum, and they're on the slide as we scroll through. 42 North Partners, AutoCam Medical, Blue Cross Blue Shield of Michigan, Comcast, Consumers Energy, DTE Energy, and Hayworth, Meyer, National Heritage Academies, RDD Corp, Spectrum Health. Thank you to those sponsors. Additional recognition is extended to all the companies and organizations that invest in West Michigan Policy Forum, many of which have supported our efforts from the beginning. I'd now like to welcome our moderator in for today, past chair for both the West Michigan Policy Forum and the Economic Club, Doug DeVos.
All right, John, thank you, and thanks to everybody for joining us here today. It's a great topic. There's a lot going on in this space about how we protect lives and livelihoods, how we open Michigan safely. It's a conversation that many of us have been having together since this all began last spring. So what we want to do now is kind of have break this presentation into a couple segments. One, where are we, now? Two, what have we learned? And three, what are some recommendations or things for us to think about going forward? Because we've learned a lot since March, right? We're not in the same place that we were. We know more about this virus. We still know it's dangerous. We still know it's a problem. We're learning about its impact on us as individuals and us, especially in our healthcare system, about how to treat it and how to help people. And we've learned how to, in some ways, start to live with it. And so we've moved, in my opinion, beyond just fear or a lack of knowledge and understanding to a point where we have understanding. Sometimes that understanding makes us a little more nervous, but many times, in most ways, that understanding gives us more confidence that we can achieve both the protection of life and the protection of livelihoods as we go forward. But it's something we're going to have to do together. And as we think about it, we have to be very diligent about our actions. And so it's important to understand the facts so we can overcome the fear. And as a business community, it's up to us to rise to the challenge. We had many early conversations as we were learning about this last spring about what different businesses were doing to the best with what we knew so they could protect their employees, their customers, and their livelihoods. And we've seen a lot of that play out. The business community has really risen to the challenge. They've had smart strategies. They've been entrepreneurial in their efforts and in their work. And they've found a way through so that we can thrive through this time, all based on the best that our medical community can give us, the science and the information that's valid. And that's what we want to do today. We want to arm you with that information, with that science, and so we can take our way and move forward through this. So we've got two of the best, and you've heard a lot of these conversations before. I'm going to ask Tina to come back from Spectrum, and I know Tina has worked wonderfully well with her colleagues throughout the medical community, and Dr. Adam London from the Kent County Health Department. Adam has been tireless in this effort as well from the very beginning of helping the business community think through how we can operate safely, what are the right protocols, how do we implement tracing technology so that when there is an outbreak or something happens, we can address it quickly. So Tina and Adam, thank you both for joining us. And Tina, I'm going to start with you. Just give us a snapshot of what you're seeing now. Where are we now?
Well, the data shows that we're actually going in the wrong direction. This is much worse than last spring. We're actually about 4 times higher than last spring. And I don't really know if we should consider it a first wave. What shocked me was when I saw our numbers compared to France. France was getting overwhelmed. They reinstated some very strict guidelines. And so I'm concerned that Michigan and France is on the same trend. We're also seeing that this is spreading throughout the state and the country. So it's much different than last spring when it was just in particular spots throughout our state. And so why is that concerning? It's because I don't think there's going to be help or a relief valve when we get full patients within our hospitals or if we need other staff. And you can see on this slide here that we're conducting about 4,000 tests a day, although we're starting to see very limited supplies from our lab manufacturers, so I do expect this number to be reduced in some days. I so wish we could get more supplies, but the higher positivity rate is not a function of getting more tests. This visible, silent, kind of stealth virus is just more prevalent in our community. And to put it in perspective, 2 months ago, our positivity rate was less than 3%. Today, you can see it's 19.6%. Huge increase. 2 months ago, the number of people in our hospitals was 35. Today, it's 322. Just think about that increase. We are admitting more people per day, and we're discharging less people. What we also know on this next slide is that the positivity rate is a precursor to the inpatient admissions. So with this high of a positivity rate today, we expect, coming a week or 2 weeks after, then the number of admissions increase. So that's why we're most concerned about this high positivity rate today being at close to 20%. We're also seeing throughout the state hospitalizations are rapidly rising and are expected to double in 14 days. and the ICUs are along the same trend. If you can pull down the slide now. I just spent some time walking around some of our units, both the traditional ICU and med surg, as well as the areas where we've expanded in our ICUs. As I walk through, almost every bed was filled. There are PPE carts, personal protective equipment carts, that are outside each room to protect our team members. Teams are wearing N95, and we're communicating with people. I'm hearing the stories from nurses and from physicians about how they are taking care of people. And this isn't just impacting older people. It's all ages are in the hospital. I heard a story this week of a young person in his 20s, healthy, active, and he's now in the hospital. I heard another story of an older woman that got COVID-19 because she didn't want to be disrespectful and asked others around her to put on their mask. This is not the time to do it. I have also heard that many people equate COVID-19 to the flu. This is not the flu. It is very serious. Just to give you an example, in a typical year, let's say fall to fall, we see about 20 to 30 inpatient influenza. For COVID-19, and we only have data since last March to now, we've seen 200 deaths. It's sobering. Every day there are people dying. And our inpatient mortality is about 1 out of 10 people. So I urge you to take this seriously. This is an issue for our community, and our hospitals and our healthcare professionals are doing the best they can to care for people in our community. But we really need to slow the spread of this virus.
Great, thank you, Tina, for that update. I have had a little bit of trouble hearing Tina, so I don't know if the team can maybe check your microphone, Tina. You cut in and out a little bit, but your message got through. This is serious, and what you're seeing in the hospitalizations is 10x. It's 10 times what you had seen, previously. So we're at that point where it's up to us to really deal with this. So this is serious information. Great time to have this conversation. Adam, Dr. London, can we shift to you, kind of get your perspective as well, what you're seeing from a county perspective?
Yeah, absolutely. Yeah, and thanks, Doug and Tina. I echo a lot of what Tina just said. And if we can bring up the slide from the health department's dashboard from accesskent.com, you'll see a picture really of what our year has looked like from an epidemiological perspective. And you see back on the left side of this line graph is late March and April when the virus first arrived in our community. And I kind of call that the brace for impact, try to flatten the curve part of this response. And our community rose to the occasion and really did a tremendous job. And business leaders rose to the occasion. We created our backtowork.com resources, the employee health screening. We communicated so much to our community that kept those numbers low through most of the spring and summer. And you'll see there that line, that dark blue line, is at about 30 to 40 cases a day the summer months. Now, during that time, we had a lot of factors working in our favor. We had summertime. Of course, people are opening windows. They're spending more time outside. The air gets more humid, which actually makes it more difficult for an airborne virus to spread. So those things were all working in our favor. We also had some fear. We had people that were scared. And so we're taking things very seriously. Now, for the past 6 to 7 weeks, we have seen this very rapid increase in the number of new cases. We've seen over that time a 10-fold increase, where we went from averaging 30 to 50 new cases today. And actually right now we're at 592 new cases per day as an average, which is more than 10-fold. And this increase is making it very difficult for us to continue to do case investigation, contact tracing. Of course, that's also making it more difficult for our hospitals to provide the sort of care that they're used to providing. Our positivity rate, the percentage of tests that test back positive, has increased from about 2 to 3% over the summer, up to over 15% as of Saturday. So this is a very concerning trend. We don't know how high it's going to go. It's a trend that we all kind of predicted, knowing that now we've got the environmental factors and the social factors working against us. We're now going into colder months. The air is drier, much more favorable to virus transmission. And we also have these three big holidays on the horizon, these three big holidays that are known for social gatherings: Thanksgiving, Christmas, and then New Year's Eve and New Year's Day. So we want to all be very mindful of where we're at right now and do the things we can do voluntarily to dampen the spread, try to flatten this curve a little bit, get our hospitals back in a good position, and get through this with the least amount of human suffering possible.
I think you've done a great job setting things up. This is serious. We have a problem. It's like the old movie, Houston, we have a problem. But we also have a few more tools and things that we've learned. So we've learned that it's reaching out throughout age groups. It's non-discriminatory in where it's approaching now. Some of those sorts of things. Talk about some of the treatments that you've been able to have, and then I'd like to ask you to talk about a little bit some of the other health issues that we're facing. Tina, maybe you can start with some of the treatments and things that we're doing a little bit different, and then maybe Adam, you can talk about some of the other issues you may be seeing, or both of you may be seeing in the community.
Yeah, so, when we are taking care of our patients, we're doing everything that we've been trained to do. So most of the time we are helping our patients with their oxygen management, providing steroids, using proning, that's where you lay on your stomach. What we're seeing is that typically if someone who comes in the hospital is there with us for about 5 to 6 days, and then hopefully after that they are being able to discharge home. But there are times where that they take a turn for the worse, and then they typically go into the ICU. And that's where we provide more oxygen management, typically an event that is worrisome as we go forward in that area. Our team has been reviewing thousands of best practices, information about how to best care for our community, and I am incredibly proud of all the work that they are doing, what they can do to make sure they're improving care.
Great. One of the things that, in the beginning of all of this, there was a huge focus on COVID, and then it became apparent that there was a number of other health issues going on, and that, just we want to broaden and put COVID, while it's dangerous, while it requires focus, also important to put it in context of the overall health of our community and some of the things that we're facing. So Adam, maybe you have some perspective and things that you can share with what else we're seeing in the community, because the isolation, the loss of a job, the economic impacts on people have also had an impact.
Yeah, that's exactly right, Doug. And I think we have a slide that shows some of these data points. And this is very concerning for us because we know that COVID not only is a major problem in and of itself, but that it also is going to exacerbate mental health crises in our community. It's going to delay screenings for other priority health problems, including hypertension and diabetes, cancer screenings. We know people haven't gotten immunizations this year for all the other vaccine preventable diseases to the same rate that we normally see. There have been studies here recently that have shown that our calls for help and our admissions for overdose have been up this year over previous years. Now, we're still looking at these data. We don't have firm conclusions right now, but we are very concerned about suicide and overdose deaths this year being higher than in previous years, largely in part, or at least partly attributed to the reality that COVID-19 has been a stressor in our community. Shutdowns, the lack of or fear of losing a job are stressors in our community. We're also seeing that people are feeling lonelier, and the social distancing is great for slowing the spread of the virus. It's a terrible thing for people's mental well-being. And so we're seeing people, especially our older population, reporting higher rates of feeling lonely or lack of companionship. And that's a big concern as we enter this holiday season, which for many people is about the only time of year where they have lots of engagement with family and friends. And now we know that in order to slow COVID, we're going to be pulling that away or scaling it back dramatically. So that's a concern, and really a call to action for all of us in leadership positions. How can we make sure that this holiday season, we're embracing our retirees, our older neighbors, and those around us that might not otherwise have much social interaction? How can we do that in creative ways so that we can make sure that we don't see this mental health crisis continue much longer than it has to?
Adam, thanks for unpacking that. Maybe I could ask you, I'm going to stick with you a little bit to talk about some of the things that you've seen, because you were very helpful early on as we were starting to reopen in the early spring, of the protocols that could be put in place in businesses. And that, in fact, many in the business community, and we'll talk about that a little bit in a little bit, have worked really hard to make their environment a safe environment. And that the transmission in certain areas of the population, it's not the same across. There are some safer spaces or safer practices when the protocols are in place, and there's some less safer places or practices. So maybe talk about that a little bit, because the need for, if you will, a complete shutdown versus the need for a balanced or informed agenda for how to limit the spread. Maybe talk a little bit about that, what you've seen from some places that have implemented good protocols.
Yeah, that's exactly right, Doug. It's one of the things that I'm the proudest of about this community is the work that we did early in the spring to create the back to work plan, to create this guidance and the tools so that places of work can be as low risk as possible. And we're never going to get to a zero risk environment unless people want to go in a bubble by themselves somewhere. There's always going to be some risk in all places. But we all have a lot to say about how much risk we're going to have. And these plans, we believe, have, in fact, reduced the risk in workplaces dramatically. And we've seen, for instance, with the employee health screening tool that we have, that over 4,000 people have been excluded from the workplace because they failed that screening. They had a fever, or they answered yes to one of those important questions. Now, not all of those 4,000 people had COVID, but a bunch of them did. And that those infected persons from creating clusters of illness in your workplaces and shutting down places of work for a week or 2 weeks or more. Also, our schools have done similar work with us to create the back to school playbook. That's made our schools much safer. So what we've learned is that when you take the tools that we have, including facial coverings, social distancing, hygiene, spacing, all the things that you've done in your workplaces, it does reduce risk dramatically.
I could
Excellent.
add,
Adam, you just touched base on school. I'm going to ask you to just confirm one more thing on the schools, of how you're feeling or what you're seeing about K-8, and then ask both of you for kind of some closing thoughts on how we think about where we are. So, Adam, anything else on schools that you want to talk about?
Yes, our schools and our superintendents have done a great job, and they've had a very difficult role to play this year. As we know, our high schools are moving virtual for the next 3 weeks. That's a decision that I actually support, because we are seeing that high school population does spread the virus more effectively like adults do. And we are seeing that most of our outbreaks are happening in high school. Now, the K through 8, we're finding that the younger kids don't spread the virus as effectively as the adult body form does. We don't know why. It's what we're seeing. So we're seeing far fewer outbreaks in that K through 8 environment. And we know those younger students really need the in-person instruction, and the older students can function for a short period of time in a more virtual environment.
Great. Very helpful. So, Tina, maybe you want to bring us home on this segment here in the remaining couple minutes that we have about kind of some final observations, and then we'll turn to John.
yeah, just if there's anything you can do, there's two things that you could probably do. One is wear a mask, and it does work. I kind of equate it to wearing a seatbelt. We don't think about wearing our seatbelt anymore. We just do. And we know that when we're in the car, it protects us. Does it prevent us from complete injury if we are in a car accident? No, but it does protect us. It's the same thing for wearing a mask. I'll also say that the social gatherings, we are seeing that this spreads in social gatherings. There's an article that we can probably send out, or here it's posted, that just shows that even one person in a room with and without mask can spread this when you're in there for 4 hours. The bottom right is the one with proper ventilation, and that's one where it doesn't really infect everybody in the room. So like I said, this is a silent, invisible stealth virus that's going through, especially with people who are asymptomatic. I do want to say that I am nice job, Doug. I am incredibly proud of our team for all the hard work this past year and for our community. We're coming together on this. This is a marathon. So we are prepared. We've done the training. We know that there are ups and downs. We know that we're going to hit some walls, and we need to make sure that we're pushing forward to the finish. What has helped us is knowing that all of you, our community, supports our work, that is heeding these recommendations. The notes of gratitude are immensely helpful and meaningful to our team. We know that there will be a finish line to this marathon. Moderna came out today, Pfizer came out last week. We know a vaccine is coming in the spring, but winter will be long. It'll be a steep hill. The spring is on the way. And so I am very proud of our teams, of our community, and I know we will get through this.
Yes, we will get through this. And I am putting the mask on for the visual of listening, because we want to take this seriously, and we have to listen to the health professionals and what they're doing. And also to say that you can do things and still perform your work in a different way, applying the protocols that Adam talked about. And so I think that's an important element. So Tina, Adam, thank you very much for your engagement here. John, I'm going to turn it back to you and give you the opportunity to talk through some of the elements that businesses have done to be able to change their protocols and still operate safely. John, over to you.
Yeah, thank you, Doug. And thank you, Adam and Tina. Your leadership has been incredible and informing our practices as an industry as we try to go through this pandemic. So no matter the industry, our businesses have been steadfast in their pursuit to protect both lives and livelihoods. And AutoChem Medical is no different than any other business. We implemented the operating safely practices that have been codified by OSHA. Our incredible workforce has done a great job of keeping everyone in our company safe and their families by strictly adhering to these safe practices. The virus is here, and we operate as everyone in the company could be a carrier of the virus. We have experienced positive cases. We've had 10 positive cases of COVID within our Kenwood workforce, so a little less than 5%. Yet the virus has not spread within the company. We have never stopped operating safely, and I emphasize safely, during the pandemic. The message I would like to emphasize is you can operate safely if the proper protocols are implemented daily. AutoChem Medical has proven that you can stop the spread of the virus with the implementation of effective prevention techniques. And we've talked about these before, using proper hygiene, wearing masks, maintaining social distance. One of the things we've done is improve air quality in our closed spaces with special air filtration devices that can kill the virus. And a key one is paying employees with symptoms to stay home until they can get a negative test. We believe what we see at AutoChem Medical demonstrates you can be safer in our workspace than at home or out in the community. In order to keep people safe and reduce anxiety, one of the things that we've done that is relatively unique is we've provided extensive opportunities for our employees to be tested. So in addition to the testing done by our healthcare providers, for anyone with symptoms or in direct contact with COVID positive individuals, we have conducted 507 tests of our employees and another 50 this morning, actually. And these tests are offered after we receive any notice from an employee that has tested positive. We test anyone who has been in direct contact with the employee who tested positive, obviously to find out that there's no spread within the company. But we also offer the test to any other employee that wishes to be tested. What's interesting is our 507 tests so far have detected 4 employees that wished to be tested but were not in contact with the people that were positive. And all of them had it asymptomatically. They were in the building working, during the day and quite frankly, the days after until they got the positive result. But it shows that when we're adhering to those safe practices, we can prevent the spread. So we've had the 10 people that were in the workplace, and we've been able to detect everyone around them. And none of the other people around them have ever tested positive. So we know that there's no intercompany spread. I think one of the things that's we've been aware of because of the testing is 5 out of 10 of our cases, or half, where the asymptomatic or the symptoms are so mild that the employee was surprised that they had COVID. Fortunately, none of our 10 cases have been hospitalized. And we know through the contact tracing, we know all the positive cases were contracted outside of work. And our testing strongly indicates that COVID protocols have prevented the virus from spreading to their coworkers, which is how I credit our employees with, keeping their fellow workers safe and their families. Unfortunately, life outside of work has not been as secure. An example is we had one employee who tested positive in November after going to a family gathering. So certainly the employee's heart was in the right place, and you can imagine this. There was a lot of hugging and kissing as the family gathered. And unfortunately, someone at that event was carrying COVID and spread it to other family members, including our employee. Given the percentage of our people that have experienced COVID asymptomatically, you can see how easily this virus spreads, even among small gatherings of family and friends. So we think you got to take this seriously. We take it very seriously at AutoCam. The spread is spiking in West Michigan. 8 out of 10 positive cases in our place have occurred since September 30th. So we're seeing exactly the same thing that Tina and Adam talked about in Kent County. We are re-emphasizing our vigilance every day on the protocols. We try to send out something almost weekly to our employees, just commenting on the importance of maintaining those protocols and congratulating them for doing it well. And we think that and the testing helps reduce anxiety and helps keep our employees and their families safe. And one of the things I'm doing today is I'm communicating, to the employees that, they need to, be very careful during the Thanksgiving holidays when they're maybe having some Thanksgiving celebrations, et cetera, and they should think about how do they do that in a way to be safe. So our indicated data indicates it's safe for work and school, and where we are strictly adhering to these safe protocols than at home or in the community. And so what we're asking today is that we all think about how we live our lives and how we alter our behavior to extend the safety protocols that we're using at work into our home and et cetera. And you can still meet, as Doug said, with family members and et cetera, but we need to look at social distancing, wearing masks and et cetera, and assume that there are family members there that have the virus. So next up, I am now excited to welcome 3 other businesses to share what they have learned during the pandemic and what creative or innovative solutions they are using to protect both employees and customers. We are going to start with a video with each one and then discuss a few points with each of the businesses. First up is Rick Keys, President and CEO of Meyer. Can we roll that video?
The pandemic has really forced us to think differently throughout this crisis, and there have been so many innovative solutions we've had to come up with and rethink how we operate our business. We were very fortunate a couple years ago to implement a mobilely enabled system that allows us to communicate directly to our team members, which we have really used throughout the crisis to make sure that we stay connected. They understand our purpose and understand the things that we're doing to take care of our customers. Around every decision that we made was how are we going to keep our customers and our team members safe. And so we changed so many things, and you can see that if you go into our stores and shop. Everything from hours of operation, from going from 24 hours to closing at night, at early hours for our seniors and those that are vulnerable, hand washing, sanitizing stations, health screens that we're conducting with every single one of our team members, the 6-foot distancing. All of those things have been put in place to make sure that we keep our teams safe and keep our customers safe. It has been such a motivating factor for our teams. The appreciation that we're hearing from our customers, the thankfulness that they have. When everything else was shut down and there was a lot of fear and anxiety over the virus and the spread of the virus, that our teams were able to show up and have those products available for our customers. That appreciation went a long way. The supply chain is really stressed as we saw incredible increases in the amount of business on key categories like sanitizer, toilet paper, paper towels. And I think our customers have been patient and understood that, and we've worked very, very hard to make sure that we keep those products in stock for our customers and to meet their needs. Well, I think our policymakers really have a lot on their shoulders as they work to try to help society manage this crisis. And as we look at cases rising, it is very concerning. My challenge to our policymakers would be to say, how do we unite? How do we come together as one to really fight this pandemic together, take it seriously, and to learn from the first phase that we saw early in the pandemic. There were so many learnings that came from that. We understand the virus, how it moves, and how we can control it. And we talked about flattening the curve early on. We've shown that we're able to do that. It requires all of us coming together in a comprehensive way to flatten the curve and to manage our behaviors. And I think that if we can be clear about how each and every one of us can affect that, I think we can be successful. West Michigan has always been a place where we've come together. We've faced challenges together. There's nothing that we can't tackle here in West Michigan, and there's a rough road ahead of us. We're really excited about the prospects of a vaccine, but it's going to take a while for that to get here and to be widely distributed. And so I think we need to stay the course. We need to stay united and figure out how we can work together to flatten the curve.
Thank you, Rick. Thank you for all you have done leading Meyer through this pandemic, and obviously making sure that we have an adequate supply of toilet paper.
Absolutely. Thanks, John.
So I just have a few questions, and it would be interesting to get your perspective on how your customers have responded to a lot of the needed safety protocols, and actually employees too. I mean, you have, obviously, you can't control any of the behavior of the people that are coming into your store outside of their work or home. And so what have you done, and how have the people responded to all that work? Thank you.
Yeah, thanks, John. I would say the customers have been incredibly positive and accommodating. I think it was at first for a lot of people, there was change, and that's sometimes difficult, but we're seeing much better compliance when it comes to masks, wearing those in the store, using the sanitizing stations. We certainly have put a lot in place to keep our customers and our team members safe. Just thinking about health screens, I got a report on that this morning. We have over 9 million health screens that we've conducted in our stores with our employees over the last 8 months. And so there's lots of vigilance that's out there, but I think we need to really redouble our efforts as we go into this next phase. So overall, customers have been very, very positive, certainly concerned about supply chain. I think we saw the panic. You mentioned toilet paper and some of the challenges that we have with the supply chain. So we do get a lot of questions on that. I can tell you that we're in a much better place than where we were when this really came on us in March and April. So we feel much better in how we're going to be able to handle the surge in demand. But overall, I think customers are in a good spot. We're actually seeing, after the orders last night, some increased activity this morning. So it's clear that the messages got out, which I think is encouraging, that customers are preparing to manage their behaviors a little bit differently.
Good. So what, are you seeing any impacts within your company on mental and emotional health? I mean, how is that going for you guys?
Well, I'm glad we're talking about that today. I have real concerns about that. You know, for us, we have about 3,000 people in our corporate office here in Walker. And, you know, we've been shut down for essentially 8 months, where we've had almost our entire team working from home. And, you know, that's different when you're in the summer. And I think now, as we head into the winter months, we're all going to be sheltering down. It's darker at night. You think about team members that are home alone. Mental health is a real issue. And so we started a while ago really being deliberately focused on how we can make a difference. How do we keep all of our team members engaged? How do we talk openly about mental health? And then how do we think about, we call it 200% accountability. We're accountable for ourselves and for our peers. And how do we think about each other during these times to help each other get through this crisis? As Tina mentioned, it's going to be a long winter, and we can get through it, but we need to get through it together.
Thank you. And so if you were to, you know, have let's say a parting message or messages, what would you share with our group now?
I think the messages as we started this session were great. You know, we can flatten this curve, but it is going to take all of us working together. We've proven, very similar to your business case, that you can lessen the impact of the virus inside the workplace. We're running 25 to 30% less than what's happening in the general population. And you think about all of the people that come to our stores. So I think the proper practices, wearing masks, is absolutely critical. I think the new orders will be helpful. And I think if we really think about how do we limit exposure, one of the things that, just a small thing, when you're shopping, only one person, maybe two, need to come and shop at the same time. We don't need to bring the entire family. You know, I think if we practice those behaviors, we'll be in very good shape, and we'll be able to flatten the curve. So I'm optimistic. I've seen what West Michigan is capable of doing, and I think we can do it again.
Thank you very much, Rick. Thanks for your leadership and all you're doing at Meyer Stores. So thank you.
Thanks, Sean.
So next up, we have a number of small businesses which have also stepped up in our community, and we're going to hear from two of them today. The first one is R&R Mechanical Services. And let's watch the video and talk with Gume Carrillo about what they're doing at R&R Mechanical. Thank you.
Well, the first thing we did, we got together as a group and put together a plan to protect our office environment, acquiring obviously masks, sanitizer, wipes, and just try to follow the mandates as closely as possible and try to maintain as much distance as we can, possibly here in our office as well. One of the things that we do is actually asking the customer what is best for them. What do they prefer for us to do when we go into their house? Do they want us to go in there with mask, protective gear, or do they want us to actually just go in, do the inspection, and then email them results? Or another thing that we've done is asking them if they prefer to videotape, and we can give them a approximate cost of the repair. Keeping the balance, even if you have to increase measures to make that work. There's a lot of families involved here and every other business as well. They all got to pay bills and eat. So I think we can find the right balance and still get the job done. I think that's very key to this. Yeah, and being that because we are heating and cooling, we are considered is essential. If that was to happen, as long as we're given, guidelines, of course we're going to stick to those guidelines. But at the same time, we want to have the ability to be able to tend to those emergencies, or people do need heat. Heat is mandatory, and it's not an option like it would be on the cooling side. So we're all looking forward to the day where we can now operate, normally, and go to our home and visit our family, and not have to worry about this. That's one thing that I would really look forward to, for those days to come back.
Yeah. Thank you, Gume. And welcome. I really appreciate you coming on. And I applaud the innovative approach to doing the video of the problem and et cetera. I think that's really thoughtful and about how to protect the customer. What have been the unintended consequences of the shutdown that you experienced, during this early in the pandemic?
Well, early in the pandemic, there was a lot of confusion on what was best, or how do we handle the situations as we come into people's homes, and how do people perceive everything that we were doing. We try to do various things, utilizing technology as much as possible to limit the exposure, the one-to-one with the customer, in hopes to make things work without having that close contact.
Have you seen any impacts from physical or mental health?
Yes. You know what? I'm into maybe 2 to 3 homes a day, and I tend to talk quite a bit to the customer. I like to talk to the customer and to see what the problems are in the home and stuff. And I see that a lot with the older generation. I see a lot of people that are, very lonely. They want to talk, but they're afraid of having the close contact. But at the same time, they want that attention because they don't have it. They're not getting out there as much as they used to. They're not having people visit them. So I like to talk to them quite a bit, and they open up quite a bit to me. So I do see that quite a bit.
Yeah. Well, and we clearly all will need heat, and so I imagine it's going to be pretty important that you're able to continue to get into homes and help anybody who has any problems as we go through this. And have you learned anything from your customers as you've gone through this?
Well, basically, the majority of the customers, they've been quite adaptive to our new measures. I mean, we do run into some customers that, frankly, they don't believe in it and they're apprehensive. But we stick to our plan. We always wear our mask and protective gear, whether they believe it or not, because it's not only to protect them, it's to protect ourselves in order to stay open and continue to do business the way we should be doing business.
Yeah. Any final thoughts that you would like to share about anything we should be doing or focused on?
Well, what everybody else is saying, it's a hard question. It's a real fine balance that we need to come up with to protect the community and also stay in business. I think it's vital that we come to it's a plan that would work for both. I'm all in with adding additional protections to make sure that everybody's protected, but at the same time, try to stay open for business.
Yeah. Well, thank you very much, and we certainly appreciate your thoughts and innovation in this time and helping everyone keep heat in the house. So thank you.
Thank you.
So the beauty industry is a key small business sector that has also been very focused on safety. And let's look at what JoJo's House of Beauty is doing under the leadership of Josephine White, who will be with us after the video. So let's roll that.
I've learned that my business is resilient. I started doing hair in the middle of a recession, so 2008. And what I've learned is that people will get their hair done. Self-care, that's a big thing, and to be able to get their hair done. So as a salon, we're resilient, for sure. You have to wear a mask. You sanitize before you come in, and then you have to wash your hands. So each station has its own bowl, its own chair. So pretty much when you come in, you go directly to that sanitized station because we sanitize in between each client, and then you don't leave that station until your service is finished, unless you have to use the restroom. But everything is sanitized daily, and we just been taking a lot of precautions. With Vagaro, our online booking system, we send them a questionnaire just to make sure that they can answer these 3 questions. The 3 questions are, have you been exposed to anybody with COVID in the past 14 days? Have you felt sick in the past 14 days? And do you agree to wear your mask during your service? They've just been great. I mean, they wear their mask. We've had clients who will call us before their appointment, like, hey, I've been exposed to COVID. Hey, I'm waiting for my test. I'm going to cancel my appointment. So I'm just thankful that we have a very trustworthy clientele. It's tough because you have to make the tough decisions to keep everyone safe. So as a salon owner, I respect that. I know that COVID is real because I've seen people who have passed away from it. So we don't take it lightly. We know that it's real. We believe it. And we just want to be safe. I've seen a lot of businesses close up, so I don't take this lightly. I don't take the fact that we were able to come back from being closed for 14 weeks. I know that it's nothing but God's grace, so I'm not afraid to say that. But I'm also thankful that we're here. I'm thankful for my team, that they've been able to adapt and just thrive in this time. So, we're just gonna continue to do the work and, visit JoJo's House of Beauty, check out our new brand, check out our website, follow us on Instagram and Facebook. We just want, to create an impact in the community. At JoJo's House of Beauty, our mission is that we want to create a custom plan for your specific hair type, and that's what we do.
Thank you very much, Josephine. Thanks for being on with us today. I am curious, have you had any I'll say, conscientious objectors to wearing a face mask, and how have you dealt with that?
We've had a few here and there, but I tell them, I'm like, if you want a service done at JoJo's House of Beauty, you have to wear a mask. We wear them, so you have to wear them. So
yeah. Well, and it's the only way to protect your staff, right?
Absolutely. And that's priority for me as an owner.
Yeah. Well, and that's what we appreciate about all of the business people that are particularly in the personal care industry, is that thinking about it's not only the customer that's coming, but it's also your staff in terms of how they're working and making sure that we don't infect them in the process of their work. Any unintended consequences you've seen from the shutdown? Obviously, you were shut down for a long period of time with your business, and I'm pleased to see it's continuing to go well, and it's allowed to continue to operate.
Yeah, I'm thankful that, like I said, we were closed for 14 weeks and we were able to come back. I would say that, I guess, consequences, like we've had just like the best months we've had in business since I've been in business for 6 years. Wow. So I guess I'm not seeing any negatives effect. I think together, like you said, we've come together. We've realized like the importance of wearing a mask. We were very conscious about like talking to our customers beforehand, before we opened. So we sent emails out, just let them know these are the things that we're doing. We've always been a clean salon, but we just took it up several notches since COVID. So we've just kept going and pushed through.
Thank you. And then how about, the questions of physical or mental health? Obviously, you see a lot of customers come in and obviously this probably was tough on your employees that were out for 14 weeks as well.
It was tough. A lot of my employees were able to get unemployment. The biggest concern is, people of color tend to get COVID 3 times more likely than other people. So That was my biggest concern, was for my stylists. I have stylists who have pre-existing conditions. So I just wanted to make sure that they were safe. So, even though we were closed for 14 weeks, some of them have anxiety about coming back. But because of the precautions we put in place, like before you come into the salon, you have to wash your hands. You have to sanitize your hands, then you wash your hands immediately. We use different capes for each client. We sanitize in between each client. So just putting those steps in place protects my team as well as the client.
Yeah, well, thank you. Have you learned anything from any of your customers as you've been through this?
Yes, I've learned a lot. As an owner, I'm always open to listening to their concerns. And the biggest thing, I was just happy that because of the way my salon is set up, a lot of our customers felt comfortable coming back. So every station has its own bowl. We bring everything to you, whether it's a dryer or processing light. So, my customers, they were excited to be back. We were excited to have them. They liked the fact that we were in constant communication with them about what was happening. We just try to be innovative. Even when we were closed, we were making videos and just staying in contact with our customers, giving them hair tips along the way. So I think we learned a lot from one another during this process.
Thank you. Any final thoughts you would have for the audience of business people here? Certainly you've modeled how to do this safely, and we really appreciate you sharing that with us and sharing your time. So, but I appreciate any final thoughts you might have about what we should be thinking about and doing.
I just know a lot of small businesses, some of them didn't make it during this time. And, I want them to know that, hey, we see you, and I'm not going to take it lightly that I'm still here. I'm thankful for the opportunity to still be here as a small business, because it's tough. Financially, being closed 14 weeks was very hard, but we made it through. So I don't take it lightly. I'm thankful, and I just want them to know that we see you, and that, I hope that maybe you can bounce back and start another business, or, move forward in a new direction. But yeah.
Yeah. Well, thank you very much. Thank you for your time, and thank you for participating and sharing your insights.
Thank you.
So thank you, JoJo. Thank you, Gume and Rick, for your time and continued leadership over the last 8 months to ensure the safety of our community and the integrity of our economy. And I would just make as a final comment, and I know this was said before, but we have a light at the end of the tunnel. What we have to do is get through the next couple of months when we've now discovered 2 vaccines that have a very high efficacy rate. And when we can get those vaccines to first our healthcare workers and then our vulnerable, obviously this will be much easier for us to deal with. But I think, that's the vision of where we're going. What we have to do is flatten the curve and reduce the spread until we get there. So how we move forward, I'm going to turn it back over to Doug DeVos.
Thanks, John, and thank you so much to Rick, Gume, and Josephine. Wow, great stories. When we started some of these discussions in the spring and put these protocols in place, as Dr. London was saying, we're hoping that these sorts of results would actually happen, and to see that happen is certainly something that we can and we should celebrate. But it doesn't mean our work is finished. But what you have seen is innovation. You have seen creativity. You have seen the entrepreneurial spirit in action to stay in business, to protect their customers. You've seen some great results of, very low workplace transmission, John, as you talked about, less than the general population in a big work population like Meyer has. You've heard about, getting closer to the customer, that R&R used it to get closer to their customer, as JoJo did as well, as Josephine did as well. And she's saying it was her best month. But we can't forget that there's a lot of businesses who didn't make that transition, that are really struggling. We know that there's some segments of our economy where it is tougher, even when they have applied their entrepreneurial spirit. So this is a serious situation on all fronts as we go forward. So if I can bring this a bit to a close, and thank you for being with us as we go through. You've seen the business community and us at the West Michigan Policy Forum try to combine that innovation and that creativity so that we can continue to live and earn a livelihood, and that we see those together. This is not, picking one or the other is a false choice. We've been guided by and close to all the medical professionals that we can find and we can seek. We have encouraged and seen people implement those protocols in their businesses, and we have seen them protect lives and livelihoods in a great way. So we want that to continue. And so we'll bring it down to these things, because we've got to learn live with this, and we've got to find our way to continue to protect ourselves through these coming periods of times, these months going forward. So here's a few thoughts to go forward with. One, you heard Adam talk about it, you heard Tina talk about it. We have to continue to be focused on flattening the curve. That remains our goal. We can't lose sight of that. And so let me kind of break it down to a few things. The first thing that we should do, we think the responsibility of businesses. You've seen that happen already. As a business leader, if you're leading your business, or you're working there, make sure you are doing these things and that you're telling your employees about it. Talk about this. Make it visible, and especially with those unintended consequences. That if somebody's hurting in another way, in another aspect of their health, not only COVID related, that you're there talking with them. You're talking about their families. You're talking and encouraging them to be thoughtful when they're outside of work, not just when they're inside of work. Because you know that you have a responsibility not only for an employee, but for their families, for their colleagues, and for their friends and our overall community. So many times we talk about a business leader and a community leader being the same thing. The second thing to talk through would be that we are acting as individuals. We go away from work too, and we're home, and that these things become real. So we continue the conversation with our families, with our kids, with our neighbors, in the same way of living safely in our lives. And we make some different decisions. Maybe they're not decisions we want to make. I want to go see more people. I want to make that sort of thing happen. But we're going to have to be patient and wait a little while until that can happen. And think of things creatively ourselves. What can we do to entertain ourselves in a new way at home? So we used to do it this way, by gathering or inviting friends over. We're going to do it a little bit differently. Even something as simple as what Rick said. When you go shopping, you don't need to take everybody. Don't make it a party. Just take what you need to get the job done for a period of time. Now, as a policy forum, we certainly have some opinions as we go in the policy space. And I want to talk about that a little bit briefly in this third area. And that is, one, we believe in, and there's a lot of talk about this from our guests as well, about unity. We believe that we need our government to work together to solve problems. As a business leader, I know you have experience, and I certainly have experience, that I reach better solutions when I talk to other people, when I get different perspectives, when I'm challenged in my own perspective. And so we want to encourage our government leaders, whether it's in Grand Rapids as a city, in Kent County, in West Michigan, or the state level, to continue those conversations and dialogues, to learn from each other, to have this iron sharpening iron sort of mentality, and so that we can find the best solutions going forward. Because sometimes the simple or fast solution may not be the best. And so I think we can challenge ourselves and leaders at all levels to be better in going forward. The second thing I think we want to recognize from a policy perspective as we go to the government side of things, there have been a lot of good things that have been done. A lot of red tape has been cut. A lot of barriers have been removed for capacity and telemedicine. Restrictions that were in our regulations have been removed. They should stay removed. As a policy forum, we see the positive impact it's had, and we believe those sorts of things should stay removed because it was the right direction to go. We've suspended some licensing restrictions that we've had in the past. It's increased our safety. It's increased our flexibility and our ability to be responsive. We have provided schools more flexibility. And we have seen that, as Dr. London said, a high school is different than K through 8. And so we want to trust our superintendents. We want to entrust people at a certain building in a certain place that they can navigate, just like we have trusted our businesses and the stories that you saw there. We can trust them to make the best decisions for their teachers, their students, and their families. And we have also seen a lot of governments move quickly to change some restrictive regulations that allowed restaurants to operate in new ways with takeout service or alcohol options that have been given, a new zone that's been created, so that there's certain things that were restrictive in the past that have allowed things to move forward. We certainly urge against another lockdown, a top-down, lock-it-down sort of thing. We don't believe that the one-size-fits-all mandate is the right way. And we believe that even more now than we did before, because the creativity and the innovation that we've seen from people dealing with this at all different levels of business operation, all different sectors. We've seen the best of the American and Michigan spirit coming through in individuals, that they have found new ways to operate. And so we think that a top-down solution or a one-size-fits-all lockdown, it leaves too many people behind. There's just too many unintended consequences, and it doesn't take into account the fullness of the health of our community and the quality of life that's needed for all of them to live a rich and full life, even in the midst of a pandemic like this. We've said in the very beginning, when some of the definitions that were put around of essential and non-essential, everyone is essential. All work is essential in our opinion, and we want to find the best creative ways that we can do both things, both live safely and work safely, life and livelihoods. And like we said, we reject the notion of that false choice that you choose one or the other. We believe that solutions can come together, that there are solutions out there. We've seen them, we've watched it be demonstrated, and we want to continue to do that. With that said, we've seen some things that work, and I'm going to repeat them here again. The policy form from the beginning, at the advice of all the health professionals, stay at home if you're sick. There's no reason to be a hero. We'd all have history of going, well, I didn't feel that well, but I kept working. I got my perfect attendance. Don't do that. Do what's right. Be a hero, and if you're not feeling well, tell somebody you're not feeling well. 2, wear a mask. It's just simple. Just do it. It helps. Let's make sure we're doing those sorts of things. 3, we've heard it from the beginning, social distance. Think about hygiene. Wash your hands. Pay attention to these sorts of things at a heightened level. This is why we were able to flatten the curve in the past. We had those environmental factors on our side, like Adam said, and now we need to operate in a new environment, because some of those outdoor activities are a little tougher to do as winter shows up. Use that PPE, use it properly, and make sure we're protecting the vulnerable. Those are the things that we have been talking about as a West Michigan Policy Forum from the beginning. So we see the role of the business community, the role of the individual, and the role of government working together. We don't just look to one source for the solution. We look to all of us for the solution and bring ourselves together in this unified way to find the solutions that we need to go forward. So the West Michigan Policy Forum is excited to be able to engage in this dialogue. We hope this has been informative for you. We're grateful to Tina and the Grand Rapids Economic Club for this opportunity. We've been doing this for a while. We've been connecting together to talk about these issues that face our community. We've done this for a number of years now, and we're grateful for this opportunity. And so, Tina, I want to thank you for giving us this chance again. I want to ask you to come back and bring us some of your wisdom and closing comments at this point.
Thank you so much, Doug, and thank you for all of our business leaders for your comments today. It was helpful to hear how you are navigating this pandemic and what you see going forward. I want to leave you with just a couple statistics that I said earlier. This virus spreads very quickly, and it's silent and stealth. Just think, in 60 days, our positivity rate went from 3% to almost 20%. The number of people in our Spectrum Health hospitals went from 35 to 320. That is a huge increase, and it's going straight up. And this is where we need our help. We know it's affecting everybody, young and old, across all populations, all demographics. It's essential that we slow the spread, we flatten the curve. You may say, well, you can just add extra beds to care for people. But I'm not so concerned about the beds. I'm concerned about the people that staff those beds. We need to make sure our health professionals, our nurses, our physicians, our other caregivers that are always with you when you are sick, that they are able to staff those beds, and that we're able to treat not just COVID-19 patients, but those with heart attacks, strokes, people with cancer, people with appendicitis, car accidents, those sort of things. It's critical for us to do that. So this is really where we need your help. Again, it's not the flu. And I hate to talk about the death rate there, the mortality rate, but it is not the flu. We've been seeing 20 to 30 deaths for flu in the past year, fall to fall. This is much more, especially when you come into the hospital, where we've seen 200 deaths in our hospitals since March. So we urge you to practice the things that Doug just mentioned. Wearing a mask. Think of it like your seatbelt. Socially distance. I know that it's hard to be separate from others, but it's critical that we do that right now to slow this spread. And know that there is a light at the end of the tunnel. And also reach out to people, because as Adam London said, we're very concerned about the mental health of all of our community. We are in this together. We've gone through so much right now, and we can't give up yet. We know that there's the vaccine's coming, and spring will be better. We all have a role to play, and we're counting on each of us to do so. And so thank you so much for joining us today on behalf of the Econ Club of Grand Rapids and the West Michigan Policy Forum. Coming together is really how we're going to move forward and be successful when we have the vaccine and when we come out the other side of this marathon. We know this pandemic will not last forever, but it is our reality right now, and we know what we need to do. We're thankful for your collaboration and for your engagement. What this community has shown time and time again is that we know how to come together. And so this concludes our event. We thank you for your partnership, and we hope you stay safe, stay healthy, and stay strong.